Should I get a hair transplant? I'm 31 years old and I've lost most of my hair in the crown area. Can it be restored with a hair transplant? And will it be a right decision to go for a transplant now? Or should I wait for more hair loss before going for a transplant? Thanks.
Thank you for your question. You're 31 years old and you state that you've lost a lot of hair in your crown and you're asking whether or not you should have a hair transplant. Well, you've submitted several really good photos and I want to share with you an approach that we have with our patients when someone like you comes in. It is no question that male pattern hair loss, especially in a lot of people, starts with significant loss in the crown area. The reality is male pattern hair loss affects the whole scalp, but it is often expressed variably, whether it's frontal recession or temporal peaks, and then of course the crown area thinning out. But when you look at your hair, you notice you didn't really lose a lot of hair. The problem is the hair has been thinning. You see, for a lot of people, hair loss is not just here today and then gone tomorrow. It's actually a progression of hair thinning. What happens is, with every growth cycle, as the hair sheds, the hair that comes back thinner. Now, the challenge, as far as they answer the question with a transplant, is two very important things. One is the area that needs to be covered. You have to understand there's only a limited amount of hair available from your donor area. The donor area is the area that's the band of hair that you see the baldest man you've ever seen with a very narrow band of hair. That's the true donor area, the genetically resistant area that hair transplants are harvested from. Now, with the popularity of FUEs, as a side note, or follicular unit extractions, hair is being, by design, harvested from outside that donor area. So, which means those hairs are at risk of being lost. But really, there's a mismatch. When you think of this space, and you just take a tape measure and look at the diameter and the area of this area of the crown, you'll know that you need thousands of grafts in order to be able to fill that area. And the reality is the average hair transplant is no more than about 2,000 grafts. But without jumping into the numbers of grafts necessary, also understand that you have existing hair. And something that hair transplant doctors generally don't talk about is collateral loss. When you take these hairs that are being transplanted, you have to make multiple incisions, little stabs. And whether you use a tiny needle, a Choi implanter, or a blade, you are, by design, traumatizing existing hair. And that existing hair will shed out and disappear. So a lot of times it's almost like you take a few steps forward, but then 2 steps back, and you end up with some improvement in density, but you don't get the coverage you desire. And typically, to achieve density, you need more than one transplant. But at 31, what are you dealing with? You're dealing with progression. So you should have also a strategy for stabilization and reversal. So in that spirit, I would suggest that you would first explore medical options. The medical options for hair loss treatment include minoxidil, which is topically applied. Minoxidil doesn't really stop hair thinning progression. It slows down the shedding of hair or prolongs the growth cycle of thinning hair. And therefore it looks like you have more hair than you actually would have without the minoxidil. The other drug is finasteride. Finasteride is well known because it has been a significant treatment for hair loss since the late 90s. Finasteride inhibits the enzyme responsible for the conversion of testosterone to dihydrotestosterone, or DHT. And you probably are aware in your research that certain people with male pattern hair loss have DHT-sensitive hair follicles which thin. So the logic is you reduce the DHT, you can get reversal of that thinning process, and the hairs can come back thicker. Now, it also is, as a note, in the original studies for finasteride, they were studied on men who had crown thinning, and they did very, very well. So it is an effective drug. At this time, unfortunately, a lot of men are not taking finasteride because they're looking it up and seeing all of the potential for long-term sexual side effects. And that has left a real void in the medical management of hair loss. So we have developed in our practice an alternative, and it's called hair regeneration. Hair regeneration is a method of using a material called extracellular matrix combined with platelet-rich plasma. This is platelet-rich plasma, which is derived from your own blood. And what we've developed is a combination, a formulation that's customized, and then a method of delivery. And through what is essentially the use of an advanced stem cell-based wound healing material, we've been able to successfully reverse hair thinning, and it has been extremely effective in the crown area. So when people have existing thinning hair, in our practice, we get very excited because we don't talk about transplants. We talk about medical therapy and hair regeneration. With this treatment, we have 3 to 5 years of data, and we have been able to help close to 100% of male pattern hair loss patients who come to us from all over the world. So I'm just describing for you what we would do in our practice for someone like yourself. I would advise against transplantation in the crown area. It's an area that nobody likes to see thin, but we are advocating very aggressively that people come when they still have existing hair. There is certainly a lot of proven benefit from the hundreds and now probably thousands of patients that we've treated from all over the world, that the earlier we get somebody when they are thinning, the more volume they're able to get back. And it's been stable. It doesn't require re-injection, at least for the 3 to 5 years in the majority of patients. I have been doing some secondary injections to try to enhance further people with more advanced hair loss. But at the same time, it has become such a great option, and I've even gone so far as to say that it exceeds the results of any hair transplant. The right patient who has a certain volume of thinning hair, there is no comparison. You get so much more volume because nature already has the hairs there. You don't have to physically transplant them. And no way can we as surgeons mimic exactly what nature already has created. So it's been quite the breakthrough, and it is something that we have been very excited about. So certainly I'm sharing with you this option because it's been so successful for us for the past several years. So once again, I would strongly advise actually against transplantation. I would advise for consideration of medical therapy as well as this newer stem cell-based treatment called hair regeneration. So with that being said, I hope that was helpful. I wish you the best of luck, and thank you for your question.